This video is about public health in the 19th century, which is for OCR History GCSE Paper 2. This year's topic is the impact of industrialisation on living conditions and health and hygiene and the development of public health systems in the 19th century. So this video is hopefully going to cover all of that. If you watched my revision video for Paper 1, you'll probably recognise this slide, because I figured it had lots of information in, but most of the other slides are either new or I've added more information to them. So in the early 1800s there was mass overcrowding due to the increase in factory jobs and the lack of railways, meaning that people couldn't commute and everyone just had to crowd around the factories. There was a high death rate due to this overcrowding, and there was also widespread disease. And there was also high death rates due to the cholera epidemic, which was due to contaminated water. The water was contaminated because people didn't know that disease could spread through water, and so they just had cesspits which leaked into the water supply for people to drink, which was a bit grim. The streets were filled with waste products because A, people threw all their stuff out the window, and B, the government didn't hire cleaners, so it just stayed there and grew, and there was more and more waste, and it was terrible time. There was lots of smoke coming from the factories, made people ill, and there was all this smoke because there was no industrial laws stopping factories from letting out more smoke. The lack of sewers at the time was due to the lack of laws forcing councils to provide fresh water, because the government didn't like to get too involved in people's lives because they thought it would make them angry. There was also a lack of doctors for the poor because they weren't paid for by the government, so the poor people didn't have much money, couldn't afford to go to a doctor, so they just died, which was really unlucky. And food was adulterated with harmful substances by shopkeepers to increase profits, and adulteration is when shopkeepers add substances like, flour and stuff to food to make it heavier so they get more money when they sell it. The main belief about causes in the early 1800s was miasma, because towns were filthy and they stunk, like it was seriously bad time. I don't know why I'm talking about this like I lived there. I didn't. I was only born a few years ago. And anyway, the people that were living there at the time, they were like, oh, there's this horrible smell, it's getting worse and worse, and more people are dying from disease. So they linked them together, which was quite smart of them, but completely wrong. The supernatural causes was sort of going downhill, people stopping to believe that God was involved in diseases, and it's becoming more ridiculous, but there were some religious extremists who still believed in this idea. The theory of the four humours was also sort of going downhill because Hippocrates and Galen had been proven wrong in other areas by people like Vesalius, and people began to realise that they were wrong about everything. Finally. I hate Galen. If you watch my other video, you'll know why. Spontaneous generation was this new, exciting idea because scientists believed that microorganisms were formed by the decay of meat, and they blamed these microorganisms for the spread of disease. Vaccinations were the big thing in the 19th century because Jenner published his findings right at the end of the 18th century in 1798, and the government started thinking, oh, let's do stuff. And I think they made vaccinations compulsory in 1952 or 3 or something, around that time. Unfortunately, there was a lot of opposition to vaccinations. There was vested interests because people didn't want to spend time getting vaccinations, and inoculators thought the vaccines would put them out of business because people were getting vaccines instead of inoculations. Some people, a bit more religious, thought that it was against God's will to give a human and animals disease, and they also thought that smallpox was a punishment for sin, and that if sinners were vaccinated they would get off, which wouldn't be fair. People just didn't like to be told what to do by the government, still don't blame them. And social, people didn't trust Jenner because he was a country doctor. They were like, you're from the country, we don't believe your ideas. The Royal Society thought that they were better than everyone else, and because they had no idea what Jenner was on about, they called his ideas too revolutionary. And then some rumours went around about clumsy doctors who had put too much vaccine into the patient, and the patient had died, which was obviously a bit unfortunate. In the 1800s, there were major breakthroughs by Pasteur and Koch, and Pasteur published his germ theory in 1861, which proved that germs in the air caused liquids to go sour, and he did this using improved technology. Koch then identified different bacteria through staining and photography. Pasteur worked out how vaccines worked. Meanwhile, Koch was discovering which vaccines caused which disease using a microscope, meaning that individual diseases could be treated. And Pasteur tested his vaccination theory and published it, which allowed loads of other vaccines to be developed, which are still used today. And in the middle of the screen there is a piece of pasta, because I like pasta. Obviously, the main section of this exam is to do with the impact of industrialisation on health, so it's probably a good idea to know what industrialisation is. And it's a process in which an increasing proportion of the population is employed in manufacturing, which leads to more factories, and that leads to more harmful smoke and fumes being released, and coal and textile dust is released in the factories, which causes disease, especially in the lungs in the people that work in the factories. There's also quite poor working conditions with horribly long hours and short breaks, leading to exhaustion and fatigue, and people just can't cope and they die. And there's also poor sanitation, with disease spreading really rapidly through factories because there's very few toilets, everyone has to share one drinking fountain and loads of horrible stuff like that. And the overcrowding, as we explained earlier, it's because people are like, yeah, jobs at the factory. But obviously no trains meant that you couldn't commute to the factory, so everyone's had to live near the factory. And landlords wanted homes to rent out built as fast as possible. So they built really cheap homes, which were poorly built, and they weren't very good for health, because they just wanted to get as many profits as they could. Moving on to Edwin Chadwick, who was born in 1800 and died 90 years later in 1890. There's a lovely picture of him there. I've got no idea whether he wore a monocle in real life. I've always wanted to try a monocle, but it'd probably keep falling out and that'd be really unfortunate. Plus I'd look like a prick. Anyway, he noticed the problems associated with poor public health, and that was that the poor lived in dirty, overcrowded cities, which led to a mass spread of disease, and many people were too sick to work, so other people had to pay higher taxes to help them, and if you're paying higher taxes, you've got less money to spend, and that leads to loads of angry people. So Chadwick came up with some solutions. I think I was going a bit fast then, sorry, I'm going to slow down a bit. Anyway, his solutions were to improve drainage and sewers, and provide clean water. Because if there's clean water, well, people won't get cholera, hopefully. Though I'm not sure if they actually knew that cholera causes these then. And he also suggested removing refuse, is that how you say it? I don't know, from streets and appointing medical officers in each area to enforce all these changes. And this led to the Public Health Act of 1848. Remember that date, very important. And that was introduced to combat the 1848 cholera outbreak with many public health improvements, like his suggestions. It also set up a national board of health, with towns being able to choose medical officers of health, and it gave local councils the option of collecting taxes to pay for reforms. The Public Health Act of 1875, another very important date, was introduced following cholera outbreaks in 1853 and 1865, and this one was compulsory. The previous one wasn't compulsory, so not everyone made the changes, but this one was very, very compulsory. All towns had to make changes, they all had to appoint a medical officer of health, and they all had to provide clean water. And the result of all this was that people lived longer, healthier, happier lives. Yay! There were three big people who pushed for improvements, as you can see in the middle of the screen there. They were all very good friends. I don't know if they ever actually met in real life, but in our imagination they were very good friends. Edwin Chadwick was the main one, obviously. We saw about him on the last slide. And he produced evidence which supported reforms and persuaded people that the reform was needed, and his recommendations were the key basis for the 1848 Public Health Act. Unfortunately, his report didn't lead to immediate reforms, and the first act was actually pretty unsuccessful because not everyone had to do stuff. William Farr was the next guy. He was a bit of a statistician, quite a cool guy. He used information on births and deaths to show where the death rate was highest, and these figures he used to prove a link between bad living conditions and high death rates, which basically showed that where there's lots of dirt, there's lots of death. And this put pressure on local governments to make changes, and some people were so embarrassed by the figures they was like, oh my god, this is cringy, and they made changes. But only some towns actually did this, and there was no big overall change. John Snow is the last guy. He published a book in 1849 which stated that cholera was spread through water. And he also wrote a report on the Broad Street pump which blamed dirty water for disease. The Broad Street pump was this pump that loads of people got their water from, and loads of people died because they drank this water, and there'd been this horrible cesspool leaking into the Broad Street pump, and that led to spread of cholera. And Snow took off the handle of the pump, which made a lot of people really confused. They thought he was a bit weird. Probably was. Anyway, he saved loads of lives, so we can't really say he's weird. Unfortunately, his report didn't lead to a Public Health Act, and loads of scientists didn't believe him. They were like, what the hell are you on about, mate? This is because, obviously, Pasteur hadn't published his germ theory yet. We also had two big factors which led to improvements, and one of them was cholera, which was spreading through Europe like a wildflower. Flower? I meant a wildfire. That was a bit awkward. Anyway, it spread through Europe like a wildfire in 1847, which caused many deaths, which frightened Britain. And Britain was like, oh my god, what should we do? And the government made some big changes. Unfortunately, they weren't very successful. I mean, the big one was obviously the 1848 Public Health Act, but it wasn't compulsory, and the National Board of Health, which it set up, was abolished after 8 years, so that was kind of a big fail. Then there was the Great Stink, which occurred in the hot summer of 1858, in which the Thames began to smell. And obviously the Thames is in London, and this smell reached the Houses of Parliament, and all of the MPs were like, oh, we have to do something about this, with their posh voices. And this led to London building an effective modern sewage system, and I think we go on to that on the next slide. Unfortunately, there was no new Public Health Act to spread improvements throughout England, so if you didn't live in London, you didn't benefit from this whatsoever. So, sucks to be you. So these are the London sewers which were set up after the Great Stink, and they were designed by Joseph Bazalgette. I think that's how you pronounce his name, but probably not. He finished work on them in 1875, although the bulk of the work was finished in 1865, and this work included 83 miles of main sewers, 1,100 miles of sewers for individual streets, and lovely pumping systems to force all the waste along. Isn't that pleasant? This is what the government did about this stuff. In the past, there was soap, which was really heavily taxed, and people just couldn't afford to buy it, so they didn't wash, and disease spread, and everyone smelt, which was very unpleasant. But in 1853, the tax was taken off soap, yay! And many people could now afford to buy it, so many people started washing, which prevented a lot of disease. Obviously, the soap probably didn't look like that, but that's what my soap looks like. And it's also got that annoying stuff, you know when the soap doesn't come off and you have to wipe it, and it looks disgusting, it's just disturbing and rant over. Conservatism is when people don't change their beliefs. They're like, we love the old way is correct. So obviously they believed that miasma was causing disease and that was all wrong, so it meant they didn't make the correct changes to make sure disease didn't spread. But when Pasteur published his germ theory in 1861, which contained scientific proof, people were like, oh, maybe we've been wrong all this time, and maybe we should make some changes. And this led to a decrease in the protests against tax increases to cover this cost, so people were like, oh, okay, we will pay. And lots of towns made local changes, and this led to a massive reduction in the spread of disease. There was also changing voting patterns, which were really important as loads of different people began getting the vote, because before 1867 only wealthy men who didn't want to pay more tax for reforms voted, and the government wanted to keep them happy because they wanted to keep getting the votes in, so they didn't make changes, didn't do too many public health acts that were extreme, that sort of thing. But in 1867, working men in town were allowed the vote. Yay! And the government wanted to keep all the voters happy, so they introduced the Public Health Act of 1875, which was compulsory, meaning the tax was collected and it was spent. And I'm really sorry about that voting box. I'm not old enough to vote, so I just had to make it up. I don't think they actually look like that. That looks like the judges' table on Britain's Got Talent. Surgery in the early 1800s was pretty dire. I don't even know if that's the correct use of the adjective, and if I'm honest, I don't really care. There was no anaesthetics, so the patients would be held down by strong men, which some people might have enjoyed, but the majority of people wouldn't want to be pinned down or screaming in agony as their leg was cut off. There was also no antiseptics, because people didn't know what caused infection until Pasteur's germ theory in 1861. Operations were conducted at speed, which led to many injuries and the loss of some external organs. And many operation wounds got infected, and some people actually died on the operating table, as you can see in that picture there with the dodgy looking oversized operation table, the dead body, the mass spread of blood, and that's because blood loss was a major issue. Next point. And this issue wasn't actually resolved until the 20th century, so sorry folks, you're not going to learn about that today. So how did anaesthetics develop over time? Well, it started with working fast, as we said, no chemicals, but very dangerous because many mistakes, people were screaming, "Wah!" and, it was altogether a bit of a frightening experience. Then Humphrey and Wells discovered laughing gas, which reduced pain a bit and didn't make the patient unconscious, and the right amount had to be used, as an unsuccessful demonstration showed. I think it was Wells, but I'm not sure, it might have been Humphrey. One of them was like, oh, we're going to show off how good our laughing gas is. Except they gave it to the patient, chopped the patient's leg off or whatever they did, and the patient was screaming out in agony, which kind of put a few people off. Then ether came along, and that was discovered by Morton, and that was very effective, but unfortunately it irritated the eyes and lungs, could catch fire, quite heavy to carry around, and we're sure that Morton would have been mortified when James Simpson came up with chloroform. You know you're sad when you laugh at your own jokes, and that was a very effective anaesthetic. Doctors were unsure of the doses, so some people died from overdoses, like this woman who had her toenail cut off and died. Because I don't know why you'd have an anaesthetic for having a toenail removed, but she did, and she died. Ha ha ha. And doctors felt that they had the time to attempt complex surgery. They're like, yeah, unconscious patients, let's cut their heart open and stuff. And that failed, and people were like, ooh, we're going to blame the anaesthetic for that. So why was there opposition to chloroform? A lot of the opposition was religious opposition, because people believed that pain in childbirth influenced women's lives and all the future decisions they were going to make. It was probably just men that were like, haha, women are going to suffer. And people also believed that God sent pain as punishment, and if people were using chloroform and not feeling pain, they were getting off. Then there were people that were concerned about the risks, and because no one knew if there were going to be long-term effects of chloroform, doctors often gave incorrect doses, and doctors attempted and failed complex operations, leading to the death down there. And conservatism. People believed that men should die bravely, and I've got a quote for this that might help explain it a bit better. It is much better to hear a man bawl lustily than to see him sink silently into the grave. I've got no idea if it was a French person that said that, and I've got no idea if that was even a French accent, but that's the one. So they basically thought it would be a bit embarrassing if men were put to sleep and had operations, because they thought it would mean that men were, like, not brave enough to cope with the pain or something like that. So how did we overcome opposition to chloroform? Well, there was James Simpson, who was like the big pusher of his idea, and he taught loads of students about anaesthetics and the benefits of them. Queen Vicky used chloroform when giving birth. She used it when giving birth to that lovely thing you can see at the bottom there. I'm not quite sure if babies do look like that, but they might do. And obviously if she used it, everyone was like, wow, we want to use it as well. And she also called it blessed chloroform, and people wanted her blessing. And doctors gradually got a better idea of dosage. They were giving less big doses and there were less overdoses, so people were more confident in it working. There were two big guys in antiseptics, Ignaz Semmelweis and Joseph Lister. Semmelweis was concerned about the deaths after childbirth, and he told people, wash your hands before operations, you might save a life. And people were like, no, we don't want to wash our hands. And they basically thought he was a right weirdo, a bit of a freak, and didn't listen to him. And he died in a mental institute, I think. But I might have made that up, so I don't know. And Joseph Lister was the guy that came up with carbolic acid, and he discovered it and developed it. And he sprayed it into operation rooms and applied it to wounds and bandages, which helped to kill bacteria, and it reduced deaths through infection dramatically, so loads of people survived thanks to Joseph Lister. You wonderful man. So why were people opposed to carbolic acid? Well, firstly, there were the risks involved with its use. It caused corrosion of the skin, so people were like, oh, our hands hurt, we're not going to use it, we're not going to save thousands of lives potentially. And some people couldn't breathe through the spray because it was quite thick, and they had to go to the window and get fresh air, which disrupted the operation, and it made operations take longer, which led to more blood loss and more chance of death. There was also conservatism. Some stupid people didn't believe Pasteur's germ theory. They were like, why? How can there be invisible things flying through the air? And people were also used to patients dying, so when Lister published his figures saying, look how many patients have survived, they were like, you're obviously making it up. And some people tried to copy Lister and use his stuff, but they didn't do it correctly, and their patients died, and they were like, this is suspicious. And Lister was believed to be an arrogant fanatic, so people didn't listen to his ideas. Moving on to the last slide now. In the 1880s and 1890s, many changes were made to aseptic surgery. So operating theatres were cleaned thoroughly to remove loads of dirt, prevent loads of bacteria getting in. Operating instruments were sterilised using steam to prevent bacteria getting into wounds. Surgeons wore surgical gowns and masks to keep themselves clean. And William Halsted discovered and developed rubber gloves to help his girlfriend, because his girlfriend had like hand issues from the carbolic acid, and so he asked a rubber company to make some gloves for her. How cute! And anyway, these gloves were also really good because they prevented germs on the skin from getting into the wound. So that was pretty awesome of him. And that is the end of the revision video for the source paper. Yay! I guess that's the easy stuff really. The hard part is working out what the sources are about, and I'm not very good at that. In the last paper, I wrote that a source was surprising because the German kid had bad fashion sense. So, guess I'm doomed. Good luck!